Okay, so the first thing I want to talk about is the anatomical directions. So first there's anterior, um, which just means in front of, so our heart is anterior to our spinal cord. Posterior is just the opposite, it means the back of, so our spinal cord is posterior to our heart. The next is superior, so superior means closer to the head, so our chest is superior to our knees. Inferior, again, is the opposite, so it means closer to our feet, so our knees are inferior to our chest. The next ones were deep and superficial. So deep means on the inside of or internal to a different structure. So our stomach is deep to our skin, and for superficial, our skin is superficial to our stomach. Superficial just means on the outside of or external to. The next is dorsal. So our gluteus maximus is on the dorsal side of our body towards the back. And then there's ventral, which is toward the front side of the body. And our nose is ventral. And then the next ones are ipsilateral. So it just means the same side of the body. So our right leg and right arm are ipsilateral, and contralateral means opposite side of the body, so our left arm and right leg are contralateral to one another. The next thing is the regions of the body. So the ones I picked are patellar, which would be our kneecap, our vertebral, which is our spinal column, deltoid, which is our shoulder, the carpal, which is our wrist, and the orbital, which would be our eye. And then finally, the planes. So we have the coronal plane, the transverse plane, and the mid-sagittal plane. The coronal plane divides our body into anterior and posterior. So we'll be going this way. The transverse plane divides our body into superior and inferior. So it'll be about here, going this way. And the mid-sagittal plane divides our body into right and left halves, so we'll be going this way.